Hello, Dr. Molly Hart here, owner of Pelvic Balance Physical Therapy. So I had an inquiry from one of my colleagues about the Iease, and I'm going to be doing a little self-experiment on myself today with this product, so I figured I would do a video about it and use it as an educational video as well. So what the heck is the Iease? So a product that I use with my female patients, especially when I'm doing online health consulting and they're not physically able to come and see me, is something called the Iease. So it comes in a cute little bag like this. What you end up getting is, a pneumatic meaning it fills up with air, little, I don't know what you want to call this, insert, and this goes in vaginally. Now you could, if we wanted to do rectal training for a man, you technically could use this. It actually is very small. It looks like it's larger than it is, but you can compress the air and it's quite small how it inserts. So that comes in this container right here. And then the other piece that you get is this little reader. And you simply connect these together. You insert this vaginally and then you turn this on. And I will use this with these women to help them do their Kegel program or their pelvic floor muscle program. The question I got was, can you use this for what we call down training? Down training is when somebody has really tight pelvic floor muscles and they're overactive, and we actually want to get them to calm down. So that's why if you are having vaginal discomfort, so forth, it's not good to just go do a bunch of Kegels because you can actually make yourself worse. So often as a pelvic therapist, we will actually have patients quote unquote down train. Once we get everything calm, then I typically, at least, I will then actually have them do a Kegel program where they go up and down in their full range. So I am gonna go ahead and put this in, and I'm gonna go ahead and show you guys how to use this. And I wanna see if we can do some down training and kind of go through how we would use this for a strength training program and also program to relax those muscles. So give me a second, I'm gonna go ahead and get set up for this. Okay, all set up now. So I've got my little reader. I stand up here. You just simply stay clothed, women, and you have this coming out your pants. You wanna stay clothed and you wanna have even maybe a tighter pair of underwear on, especially if you're postpartum. It can actually kind of fall out a little bit easier than you would expect, unfortunately. So you wanna put something tight on to help keep that inserted vaginally. Okay, so we're gonna do this standing today for the down training. You can do the up training where you're squeezing in any position, but I just did a little self-experiment, and you cannot do down training in a sitting position, because as I go to push my muscles down, my pelvic floor, as I push it down and stretch it, it's actually increasing the reading on here because now I'm pushing it into the chair that I'm sitting in. So it's just reading pressure. So it's not doing it how I'd like, but I'm gonna show you here in a second how we can use this in standing for both up training, squeezing that pelvic floor, down training, lengthening that pelvic floor. Okay, let's go over real quick too. There's different ways a muscle can contract. Okay, let's use our biceps for an example. So one way a muscle can contract is, if I'm talking about my biceps attaches right around this region, and it's got a couple attachment points up here. So when it contracts, think about it like a rubber band, it's gonna shorten, right? So I shorten. We call this shortening a concentric contraction, or it's also known as a positive. Sometimes in the workout world, they'll call it a positive. Okay, I can also, so that's a shortening of the muscle. So that's when people think of a Kegel, they're shortening their pelvic floor muscles, okay? Now, I can also do what we call like an isometric exercise, and that's where I'm just holding. Isometric, I just hold. So right now I'm gonna put pressure, I'm pushing my arm this way, but it's not moving. So right now my biceps is engaged to prevent my arm from moving. That's another type of contraction that the biceps can do. And this is all muscles. The last thing that a muscle can do is it can actually contract while lengthening, which is a really great way to work it out. So if I hold my arm here, I'm gonna engage my biceps, and this hand's gonna actually push my arm down. So if I push down, as I'm pushing down, you see my biceps is working because my biceps is preventing my arm from just fully going down. So I can just push my arm down, no biceps activity. But if I slowly control that movement, my biceps is slowly controlling that, okay? So when we push down, when I bear down, meaning like I'm having a, let's say I'm bearing down, that's when I'm lengthening that pelvic floor bowl downwards. When I quote unquote down train my pelvic floor, instead of squeezing and lifting up, I'm actually like, I'm lengthening it is what I'm trying to do. So it's a controlled lengthening. When we look on here, we should see less of a reading, less of a pressure reading, because we're actually lengthening and creating more space in there. Therefore, the reading should go down. Okay, so I'm gonna turn this on. All I do, there's only 2 buttons. It's super simple. There's one here and there's one on that side. Okay, so I'm gonna turn this bad boy on. It's very simple. While I'm here, you can see it's backwards for you guys. It says test. If I press a button, I can go to training mode. I'm gonna go to test mode right now. So what I'm gonna do is I'm gonna stand up now. As I stand here, this just pumped up. Okay, so it's at 55. It looks like 22. It's at 55 right now. It always pumps up to 55 mmHg, which is the pressure reading. Let me readjust for just a second here. Okay. So I'm standing. As I'm here, you guys, I'm sorry these numbers are backwards. Maybe I can flip the video and maybe it won't be backwards. I'm gonna squeeze my pelvic floor and you see my numbers go up. You can also see the bars right here are reading as well. So if I squeeze my pelvic floor and do a concentric, you can see it goes up for my numbers. Back down, squeeze, and I go up. Let it fall back down. Now, if I want to do down training and push down, I can. And you can see it's staying at around 55. So I'm pushing down and it's staying in a lower state. I relax. I squeeze up. I relax. I squeeze down. And you see it goes down. So it's not a significant downward trajectory, but it is going down. I squeeze up. I squeeze down, lengthening. Okay, now as I'm squeezing down, this probe is falling out. Okay, I'm pushing it out, which is really what you should be doing. So I'm gonna go ahead and turn this off. All you do is hold that button down and it actually deflates itself. Okay, so if I was gonna be doing this as a program myself and I was actually walking a patient through this, I would have them do their own exam on themselves, which is what I teach people how to do online. But if you have a pelvic therapist in person, this is a tool you can use that's not too expensive, because some of the tools, some of the at-home units are very expensive. I personally like this because it is pressure, it's pneumatic. Some of the other ones, they work in a different manner and I'm not as big of a fan of them. This I know is accurate. It's like a pressure cuff, right? So we use pressure cuffs for our blood reading. I mean, it's so simple and I like that it pumps up a little bit. It gives you what we call this proprioceptive feedback, meaning it gives you more input on the vaginal tissue so you can really feel what you're doing with this. So I'm a huge fan of this. It's cheaper, so forth. It's not too expensive to use. Anyways, using this, if you were to insert that and your therapist is trying to get you to do a down training to calm pain down, or maybe you're having constipation and you can't properly evacuate a bowel movement, using this and actually trying to get the probe to come out of the vaginal cavity is what we are looking for. We're wanting that to come out. And then you just would tuck it back up in there and you would continue along with your program from there. So I hope that this was helpful, both for women who are looking into this and also therapists. If you guys have women who can't afford a lot of the sessions with you, maybe they can't get into the clinic because they have kids, or if you're doing online telehealth, this is a great, easy tool that you can utilize. So if you guys have any questions, please message me, comment below if you've used this before. If you have another type of device like this that you've used that you really like, comment below. I mean, let's educate each other. Let's hear and have an open dialogue about this, okay? All right, have a wonderful rest of your Monday, guys. Bye.